man in charge of America's drug war. He made history when he was announced the first physician ever to serve in that role. It comes at a time when this country is battling an extraordinary crisis. An American dies every 5 minutes by overdose. On this broadcast, we've gone inside prisons and to our southern border to see what's happening. This week, we went to Washington. The estimate is that the overdose crisis costs us $1.5 trillion a year, which is equal to the GDP of Russia.
Correct. So we're losing that amount of money each year.
Rahul Gupta was born in India, but raised in Maryland. As a doctor, he's seen addiction patients recover, and he's attended funerals of those who did not. After running West Virginia's Public Health Bureau and working for the March of Dimes, he became director of the Office of National Drug Policy Control.
You're the first physician to serve in this role. What message do you hope that sends?
Well, I know that the message it sends is that this is a public health crisis that the nation is enduring.
As Gupta told us, gone are the days when the root of the drug scourge was found in poppy fields and on farms. Today, it's a chemical world, especially when it comes to fentanyl, something President Biden discussed this week at a summit of North American leaders in Mexico.
Today, we've discussed how all three of us can continue to deepen and strengthen our shared efforts to cut off the flow of illegal fentanyl, including by tackling the precursor chemicals used in synthetic drugs.
So many of these precursors for fentanyl are coming from China. Why can't more be done to limit the amount coming in from China?
Well, that's exactly what we're doing. From day one.
It's still coming in, though, a lot.
Well, what we want to do is make sure that we are working with the People's Republic of China, or PRC, to make sure that they are holding accountable the bad actors within China that are shipping. But we also want to make sure that we know what's coming in before it gets here. That is not happening to a level that it's acceptable to me at this point, and that's exactly why we're continuing to push them to do more.
Is the bigger problem the bad actors in China who are selling the precursors, or is it the drug dealers and the cartels in Mexico who are using those precursors to manufacture?
I think, Jeff, what you just highlighted is the global imprint of this problem.
But Gupta says he's focused not just on supply, but demand, and what's called harm reduction. That means not waiting until people ask for help, but instead bringing it to them.
We meet them where they are as opposed to expecting them, and I say this as a physician, to come to my office or my place, because oftentimes it's too late, and you cannot treat a dead person.
The Biden administration has not rejected the controversial idea of expanding safe injection sites where people can legally use drugs. Legislation remains tied up in courts. The administration has openly pushed for drug treatment programs inside prisons. But it's also not changed the standing of Gupta's job. For the past 13 years, the drug czar has not been given the clout to speak regularly with the president or sit at cabinet meetings.
President Obama demoted this position from cabinet level. Are you hoping that your boss right now re-elevates it to cabinet level?
I come to work every day, and I focus on everything that I can do every single day to help Americans out there, make sure that they're living longer, they're being able to have safer and healthier communities as such. And that's where my focus remains.
Is that a yes or a no?
Well, I'm going to continue to do what the American people want us to do, which is to make sure that we're working hard to end the opioid crisis, and I'm going to keep doing that.
Lately, there has been some better news. New data released this week shows overdose deaths that surged during the pandemic have declined slightly for 5 straight months.
We certainly feel confident that there seems to be a light at the end of the tunnel, meaning that we've now seen about 2.25% reduction from the peak of overdose deaths. That's about 2,500 people. But think about it like a large ship. You can't just turn it around. You've got to slow down, and then it takes time to turn that around.
The question is whether that dip becomes a long-term
Right.
trend or whether it's just a temporary thing. But overdose is now the leading cause of death for Americans age 18 to 45.
Wow. I think one of the most interesting things that he said to me is the idea that you got to meet people where they are, that there are all of these problems. What can you do in the here and now? And part of that is meeting them where they are to try to solve the problem here, not just worry of the others.
As he said, as a doctor, I can't treat a dead person.
Right.
Yeah, and then if there's this like understanding within those users, and many
Yeah.
of us know people who use even things like marijuana. They think it's safe, and with these new fentanyl being manufactured in certain drugs that people thought at one time were safe, hey, it's a wide open horizon. Nobody knows.
A lot of this is just fentanyl being used by itself, but it does happen.
Yeah.